Hey y'all, can you hear me?
Hey, I hear you and see you,
Yes. Great. Okay.
and I believe you can hear and see me as well.
Okay. I can. Awesome.
Let's see. Got two screens going, and it's always so confusing.
I know. Have you guys attended a lot of this conference so far?
Every time I try to attend a session, I have some sort of technical issue. I was trying to attend the housing session this morning, and I still haven't succeeded in seeing that one. So we'll see. Oh, I did it. I did actually. No, I'm lying. I attended the keynote yesterday, and it was really great.
Oh,
The history of systemic racism.
yeah, that one was so good.
She did such an amazing job of, first of all, the material was just incredibly powerful, and it was an incredibly good presentation content wise, but also she was so engaging.
Yeah,
Just a model presenter all around.
I agree. Yeah, a couple of my teammates had talked about her being one of their like mentors or one of their idols, someone they would love to have as a mentor. And I had never seen her speak or really known much about her. And after seeing her yesterday, I was like, oh, I understand why. Yep.
Yeah. Yeah, absolutely. We have a standing Wednesday team meeting where we do like project updates, and then um, we have like an ongoing like equity conversation for the second part of the team meeting,
Mm.
um, where we just have sort of rotating topics. And so we hadn't really lined up a topic yesterday, and so we um, ended up defaulting to discussing that session yesterday, and we were all in awe. It was very good. Joe, how are you doing?
Doing well. I was listening in on John's presentation while I had this window open and I was like testing things. And then I started hearing you two talking over.
Yeah. Uh-oh.
It looks like we lost him and the screen.
The dangers of exploring other people's sessions, I guess.
These things are so hard because when they're virtual, because it's so easy to multitask and it's so easy to not be fully present. And when you get to be there, you almost have to be fully present.
I mean, people are multitasking even when you aren't virtual.
Exactly.
That
Exactly.
was actually one of the things that I was so impressed with yesterday was the challenge to the audience of saying don't multitask, and then the moxie that it takes to sit in a room by yourself in front of a webcam and have your slides auto playing, and to believe in yourself and your audience enough to just be for 10 minutes or so,
Yeah.
and just know and just say, just I don't know. I was really impressed with that. To say don't multitask, and then just sit there and have it play, and have your audience that you can't see.
Yeah.
I was like, wow, and I didn't multitask. I was really.
Well, the funny part was I was multitasking. I was started the session with like doing my dishes, and then she said don't multitask, and I was like, oh, it's probably not that big. I mean, whatever. And then the slides started playing, and I stood there with my wet hands and my dishes in like my dish in my hand, just like mouth wide open, watching the screen, and multitasking wasn't working.
That's really funny.
All right. Are you hearing me? Okay.
We hear you and we see you. We don't see your slides.
Okay. had a little heart attack there when everything froze up.
I bet. Like it's all gonna be okay though. All right, we have 5 minutes. So Joe, I know you said you watched a session earlier that was a YouTube presentation, but it sounds like videos are not playing during presentations. Is that correct?
So yeah, I mean, I entered the room and it was just a link in the chat to a YouTube video.
Okay.
So it was not, they had recorded it earlier.
Okay.
Or streamed it live on YouTube or something. So it was.
So we might want to enter the chat in the chat. We might want to enter your example videos so people can go watch them later if they want to.
I took a screenshot of them and I figure I'll just kind of describe them.
Okay.
And then yeah, I have a link.
Okay. Yeah, I think they're probably not going to play during the session, is my understanding. But
yeah. These slides aren't showing up, right?
No, not yet.
It looks like ourselves included, there are 7 people in the room right now. It's a little hard because you can see as people enter what their names are, but you can't see who everyone is, I don't think.
Joe, I don't know if you saw this message from Elizabeth Holland or not.
Yeah, I can't really type either. What's going on? This is frustrating. Elizabeth, I'm having trouble sharing my slides.
If you want to email them to me, Joe, I can try to share them.
I was checking if Elizabeth Holland had any tips for me, actually.
Oh, you were talking to the other Elizabeth. Yeah, if Elizabeth Holland wants to share them, that would also work.
And then the
I look like I have the ability to share my screen, so if we want for me to try that, I can do that. But I don't have the final slide deck, so Joe, I would need you to email that to me real quick. Oh, we just lost Joe.
Hmm. It also looks like I may have the ability to share my screen.
Cheryl, we actually don't need to do Zoom because Elizabeth Thomas
And
has
not
the
that
ability
I
to share.
don't want to entertain questions.
Hey everyone, thanks for bearing with us while we endure a few technical difficulties. We'll hopefully be getting started really soon.
Hi, Anna.
It looks like I actually do have the whole presentation. I thought I didn't, but looking at this, I think I do. So I'm going to go ahead and present.
Okay, that works.
Great. And I was just looking through my email, and I apologize again for the delay to everyone. And I'm going to try to share my screen again. And
it looks like we have Joe back, so that's great too.
do you all see my screen?
Yep.
Great. All right. Well, I will get started. So welcome everyone to our presentation. So we're going to talk quickly about effective messaging for the COVID-19 pandemic and our academic health department collaboration. And I will go very quickly through my introduction of academic health departments. If you are not familiar with the model, it's analogous to teaching hospitals in that they serve as sites for education, research, and practice. And they strengthen the links between practice and academia and lessen the separation between education of public health professionals and the practice of public health. Strengthening and developing the current and future public health workforce, which, as we all know, is really important to build those bridges. And Granville Vance has Gillings Professor of Nutrition, Dr. Samuel Hodge, serving as a translational and implementation research specialist several days a week, actually on site at the health department. And in this role, she has helped lead the agency's efforts in chronic disease prevention strategies, nutrition, and physical activity interventions. And she is amazing. And anyone who knows her already is very well aware.
Elizabeth, it looks like your slides are not progressing forward on our screen.
They are not. I apologize for that. So that's my first slide. Again, technical difficulties seem to be plaguing us today, but that is my first slide. So I will just pause there for a moment. So what is the work? Basically, the work is we're able to provide surge capacity for projects like community health assessments. We have worked on a couple of community health assessments with Granville Vance, also several state of the county health reports and annual reports, and also special projects like the Stepping Up Initiative, which is a really cool project where the health department is leading 7 counties, looking at ways of improving services and supports for people with mental and substance abuse issues in the jail systems. And having this relationship has been really, really cool when special circumstances arise, because it means that we can support the health department in other ways. So when COVID became an issue, we were able to jump in really, really quickly and turn around basically immediately. There's about a 1-week turnaround between saying, hey, we have comms availability and we could provide some support at this time. And if you're interested in that, and basically we were able to say, do you want that support? And then within just a few days, we were able to set up a meeting with Kelsey and say, what are your needs? What would be most useful? Who are you trying to reach? Where are you trying to reach them? How are you trying to reach them? What kinds of methods are you trying to use? And where in the community do you think we should be targeting? And then we were off and running. And it's really an honor to be able to serve public health in North Carolina in this way. And it was a really, really cool project. So Joe, I'm going to turn it over to you. Just tell me when you want me to advance the slides and I will push forward.
Great, thank you. That initial sort of startup phase involved some strategic planning on first what kind of messages we wanted to send and yeah, things like our audience. It was informed by a few ideas in crisis messaging. One great resource for that is the CDC's Crisis and Emergency Risk Communication Manual. And that is a handful to say, and it is a lot to read. So I just put a link to that in the chat. That manual has about 400 pages of text in it and a whole lot of different sections based on who you're communicating to and how you're communicating. The Communications Network released a really good summary and takeaways document. They called it Insights and Ideas from CDC's Crisis Communications Handbook. So here's the link to something that's a little more digestible, about a 5-minute read, that has sort of big ideas for how you should communicate in a crisis. The idea is that you should keep your messages simple, use consistent messaging, stating the benefits of taking action, promoting simple actions, and also sharing stories of what you want people to do. So for example, Elizabeth, can you advance the slide, please? We wanted to share some hopeful messages for folks during the coronavirus. There's lots and lots of fear going around. Fear and despair are two pretty bad motivators, and there's already plenty of fear sort of in the atmosphere around COVID. So pushing hopeful messages like, have you ever saved a life? On the next slide, there's another sort of hopeful message. Stressing the positive things that you can do rather than the negative things you shouldn't do. It gets people on board better. It gives them a sense that they are effective at this. So during COVID-19, a lot of the behaviors that we wanted could be described in a negative way. Don't leave home, don't touch your face, don't get too close to people. But messaging that you can do something positive often helps people to internalize those messages better and actually follow them. It feels kind of like lectury and naggy sometimes to try to say a bunch of things you shouldn't do. So we try to spread these hopeful messages, simple messages of things people can do to help prevent the spread of COVID-19. In addition, on the next slide, we try to answer specific questions. There's a lot of questions about coronavirus and a lot of things, honestly, that we didn't know for sure, but we had good general ideas about. So there was some sort of concern, confusion over whether or not coronavirus affected pregnant people differently, and it wasn't sure. But you can always say that staying healthy during pregnancy is a good idea. You don't want to be sick when you're pregnant. That's sort of general advice. A lot of these specific questions came from the CDC or NCDHHS. They have a lot of info on their sites. We branded them to be Granville-Vance specific. We put the Granville-Vance colors and the logo on there, as well as the Granville-Vance public health URL information. That website had a lot of specific information on cases, but also testing and resources in the county. Getting this information from CDC also helped us because the CDC has these sort of specific questions and talking points in a lot of different languages. So on the next slide is the same, is it okay to donate blood, but the whole message in Spanish. And that was helpful for us because we were trying to reach different audiences and different people. Generally for this sort of month-long campaign on Facebook mostly and in print, we stuck to English and Spanish. But the CDC was great, and it is a great resource because they have about I don't know, 6 or 10 different languages for each sort of message that they put out, and good translations. You know, you can type things into Google Translate and try to get a good, you know, simple message, but you don't. It's not reliable in terms of getting these long like paragraphs and good things translated. So we were trying to hit different audiences in different places. So on the next slide was a flyer that we created. We came to understand that there was a need for information, simple, straightforward, about what to do if you feel sick. And in particular, this need was in the Spanish-speaking community in Granville and Vance counties, getting the message out that if you feel sick, you should not be going to work, when you should go see a doctor, things like that. So in designing this flyer, and in a lot of our materials, we thought about the simplest way to deliver information. So you notice this is colorful and attractive, which is nice for getting people's attention. But we've got these big icons on here, which are pretty universal to understand. The sentences, are short. The things are pretty easy to remember. There's not a whole lot of text on this page. You can read it pretty quickly, even if you're just kind of walking by it or standing in line somewhere or something like that. So we made a few of these sort of print materials to put in local businesses and hand out to people, always with an eye towards being able to read it quickly, being able to understand it at pretty much any reading level, and getting those simple messages out quickly. Next slide, please. We were also taking inspiration and the leads from other public health and government agencies. A lot of agencies were putting messages online, different types, educational, funny, silly. This one in particular is from Lori Lightfoot, Mayor of Chicago. I'm afraid I can't share the videos with you, although they are fun. So if you want to check them out, all of them are compiled here on this Twitter thread. Just sort of fun, short videos about why she has decided to stay home, a personal sort of investment in keeping other people safe. They're funny, they're silly, they're the kind of thing that get shared around the internet because, hey, it's look at our mayor being silly. So online, these are great for getting people to hear a message about staying home and saving lives. The idea of different messengers is also really important. We've been talking a lot about messages, but who delivers the message is also really important. Trust varies a lot among public and private figures. So you trust your friends more than you trust a stranger. Around the country, people trust teachers a lot more than they trust politicians. They trust doctors and faith leaders and public health workers more than they trust politicians in particular, rank really lowly on trust. Local and state politicians are a little better than national ones, but once you get up to national, senators and things, trust pretty much bottoms out in terms of national, public figures. So as we were getting inspiration from other government agencies, on the next slide, we saw these videos from Durham. Sorry, these are from NCDHHS. But this was a faith leader in Durham who was delivering a message about staying safe, staying home, wearing a mask, wearing a face covering rather, for Black and Latinx communities hit particularly hard by the coronavirus. On the next slide is a similar message from Dr. Viviana Martinez Bianchi in Spanish. She's a physician, another really trusted messenger, and an associate professor at Duke. So she might have some visibility in Durham, but also physicians are pretty well trusted. So these messengers are pretty important. We tried to get some things like this going in Granville Vance, some videos. We kind of had a short turnaround for this, and it turns out a number of people, I guess, were camera shy in Granville Vance. So this was one thing we tried to get off the ground, didn't quite work, but still important. And we also, in the process, kind of created a plan for doing this, which involves some problem solving and strategic thinking. On the next slide, we found that this was also an opportunity to promote other health services, other health department services. While the Facebook page for Granville Vance Public Health was getting more and more followers as people were curious about the coronavirus and finding daily updates on numbers and things like that, we were able to talk about counseling for diabetes and WIC and all sorts of other programs that have always been there. But now that we've got more eyes, and these things like smoking cessation might be top of people's mind. These comorbidities came up a lot in the news and things when people would get sick. So with the new eyes on Granville Vance Public Health, we were able to promote other services. As the pandemic sort of wore on, we realized there was also a need for more nuanced guidance around it. The message, stay home, stay home, stay home, doesn't help people if they have to work or if they're just getting, tired of sitting at home all the time. And the risk is with sort of absolute messaging, sort of abstinence-only education, this kind of thing, is that if people break the rules a little bit, they may just go the complete opposite direction. So if your only messaging is stay home, stay home, stay home, and someone decides to leave, they may just go to a crowded restaurant or bar, do some of the more risky behaviors. But if you educate them about the sort of gradations of risk, you can let people understand that it's not all or nothing. That going outside is probably safer than meeting a bunch of people indoors. Wearing a face covering is a little more safe. Avoiding crowds, things like that. So you get this sort of harm reduction perspective instead of a all or nothing approach. This also came with changing guidance and just more knowledge about the risks involved. Back in March, we didn't have all this wealth of knowledge and experience about where outbreaks had happened and all that background. So this helped. Pretty much later in June was when we rolled this out. And I'll hand it over to
Great,
Kelsey.
thanks, Joe. So as Elizabeth was, perfect, thank you. So as Elizabeth was talking about a little earlier, we have this academic health department model, and it really provided a huge opportunity here that we otherwise would not have had. NCIPH provided surge capacity and expertise that was absolutely necessary in the beginning of the pandemic, and really had helped us grow our COVID messaging into a sustainable model that now we are able to maintain. And we grew our Facebook and social media following by a large number, and we're able to distribute a lot of printed materials throughout the community. And it really was that initial push, and allowed us in-house to focus on the contact tracing, case investigation, contact tracing, and data management that we needed to focus on. Granville-Vance is a small rural health department. We are pretty lean, and so we don't have anyone specifically dedicated to communications. And so it was helpful to be able, for me as the health promotion and wellness supervisor, to be able to outsource some of that communication stuff as I focused on pivoting our health promotion programs and then supporting the clinic in our response. And it also allowed me to focus a bit on building our partnerships in our community. So I was able to deliver to our partners printed materials within days, because I could turn around and ask Elizabeth and Joe for them. And so it allowed me to really focus on building those relationships and being responsive to community. And community was incredibly appreciative. It's been quite a joy to get to go to businesses and see some of the materials that Joe and Elizabeth created in those spaces. So we were able to really mobilize quickly. And then, as Joe mentioned, it increased our visibility within the community. We now have a much wider audience in our social media platforms, and that has allowed us to promote the other resources and services that we have at the health department, and broaden our reach, and ensure we're getting more folks into our programs and into our clinic. So it was a great partnership, and I really enjoyed working with Joe and Elizabeth. Does anybody have any questions? I see Joe's responded to Vicky's in the chat. Is there any other questions? So I work at the Granville-Vance Public Health Department, which is Granville and Vance counties are just north of Durham County, right on the Virginia border.
And Joe and I are from the North Carolina Institute for Public
And
Health.
Elizabeth and I are at
I apologize for leaping into our session kind of awkwardly and not doing proper introductions. I was a little flustered by our technical difficulties at the beginning, but we're from the North Carolina Institute for Public Health, which is in the Gilling School of Global Public Health. Be happy to type our email in. I'll type my email and I'll let Joe do his.
Thank you all. That was great.
So I don't know how many folks are in the room, but I think we're waiting for the previous session to end.
If anyone else has any other questions, please don't hesitate to reach out to us. We would be happy to chat further. Agreed, Vicki.
Carol, to your question, we don't, Granville and Vance are not in the same region as Forsyth and Guilford, so we don't interact with those health departments quite as often, but do occasionally interact with Forsyth and Guilford. I don't know about you guys at NCIPH.
We've definitely worked we've worked in every single county to some degree or another, but haven't done comms work per se in Forsyth and Guilford. But reach out if this is something that you want to talk more about, or if you have any questions.
Are we supposed to leave?
Stop sharing my screen.
Yeah, I don't know if it will end automatically, but nice work, everybody.
All right.
Thank y'all.
I'm going to go off to our next sessions, I guess.
Mm-hmm. See you
All right.
soon.
Thanks everyone for coming to the session. We know.
Jamie.
Thanks for coming to the session, everyone.